Before we start, we would like to say thank you to you all for your contributions to making transfusion safe for patients, especially given the challenge you are currently facing in your day-to-day working environments. Also, thank you for joining this webinar today, and we hope that you find it useful. I think that covers the housekeeping aspect of this webinar. So without further delay, we will get on with the presentations. We have representatives from SHOT, the UKTLC and the MHRA with us today. And we are also joined by 2 additional panelists from our SHOT Working Expert Group. We will start off the presentation with the background from SHOT from Dr. Shruti Narayan, followed by a presentation on the background from the UKTLC by Chairperson Kerry Dowling and Deputy Chairperson Dr. Jenny Davis. We will end with a presentation on the MHRA perspective by Chris Robbie. So without further delay, I will hand over to Dr. Shruti Narayan, who will be covering the background from SHOT.
Thanks very much, Karen. I don't know if it is only at my end. I think it has come off the presentation mode. So if you want to share it in the presentation mode again. I'm Shruti Narayan. I'm the Medical Director of SHOT. And while Karen is actually sharing the screen, I think over the next couple of slides, what we would be covering is just giving a background of SHOT and how UKTLC came into existence, which Kerry would be actually going into a bit more detail. So SHOT, as you know, standing for Serious Hazards of Transfusion, is the UK Hemovigilance Scheme. And we are partly funded by all the 4 UK blood services. And we collect reports related to the serious adverse reactions, as well as serious adverse events. And more recently, we have also started excellence reporting. And largely, SHOT collects these incidents related to the blood components, but we are also actually then having some of the blood products that are actually included as well. And if you move on to the next slide, so safety is at the heart of everything that we do. So, whatever activities, it is not just collection of the data for data's sake, it is actually has to result in quality improvement and enhancing transfusion safety. And when we talk about transfusion safety, there are 2 aspects. So we talk about the safe blood components, but it's also about the process-based safety. And if you go on to the next slide, and to just give you an overview of the extent of the blood transfusions around the world. So around the world, we have 18.5 million units of blood that is donated every year. And in UK alone, more than 2 million blood components are issued annually. And this is actually despite a gradually reducing trend in the use of the blood. And this illustration you would have seen previously as well is actually an illustration of the blood supply chain. And I've used this here to actually highlight that whether it is at the blood service end or whether it is actually at the hospital end, what we really need is actually a close coordination and communication between the clinical as well as the laboratory teams. So if you move on to the next one, and this infographic, all of you may be familiar with, this is actually telling the 10 steps of transfusion. This is at the patient end, right when you're making the decision to transfuse and consent the patient. And here, highlighted here are the key steps that are really important in the laboratory. So going from the sample and the request receipt to testing, component selection, and labeling. And these are the critical points that we are actually going to be covering. And here is the synopsis of the laboratory errors that were reported to SHOT in 2021. And the bars on the right will indicate both for the errors that were reported as well as the near misses. And as you can see, the red bars, which are for errors, the maximum number were actually at the component labeling step, followed by the testing step. And the same with the near misses, the maximum number were reported in the component labeling step. And overall, when we look at the errors, the laboratory errors accounted for 12.3% of all the errors and 15.9% of the near misses that were reported to SHOT in 2021. And as you all may be aware, we are actually then working away on the next SHOT report, which will be released in our upcoming SHOT symposium. And if you go on to the next slide, now here, I'm not going to go into a lot of details, but this is actually just giving a flavor of all the things that are commonly seen with the different steps. So it may either be due to information that is actually not heeded to, or we're not accessing the request on information that is available on other platforms such as SPICE, or there may be other extraneous factors such as inappropriate electronic issue, invalid sample test used, or incomplete testing, or with the component selection. Again, there may be factors which are, there are failure to follow the information which is readily available within the LIMS. When we come to the component labeling, most of those errors are cold chain errors. And this is kind of the last step where the component is under the control and care of the laboratory. And therefore, there should be actually a pause here, and there should be actually safety checks that would then be ensuring that the right component is actually going out of the laboratory. And if you go to the next one, this is actually just indicating the numbers. So the bars are actually showing the total number of laboratory errors over the last decade. And you can see with effective patient blood management, the red line is actually indicating the total red cell units that were issued in the UK. So you can see an overall gradually reducing trend. And we have also shown where the lockdowns were during the pandemic period and when it was actually lifted. This is actually just to reflect the impact of the pandemic on the use of the blood as well within the UK. Now, as you can see, although there may be an overall slight reduction in the number of the errors that are actually being reported, the patterns seem to be the same, and the key themes that are emerging of concern are actually then continuing to be the same, and the proportion of these errors reported are also continuing to be the same. If you go on to the next one. Moving on quickly, so you know that shock was actually started in 1996, and since then, when the patterns of the errors were actually then evident, there was, many of you may be aware of the better blood transfusion letters that were actually issued. This was focusing largely on the clinical practice of the transfusion and did not really address the laboratory problems. And so what happened? Now, we were also actually seeing worrisome trends. So we saw nearly 37% of the incorrect blood component transfused were due to laboratory errors. And that was actually reported in 2005, incidentally, the year when the BSQR, the blood safety quality regulations, came into practice. And it was then SHOT then invited the Institute of Biomedical Science to collaborate in the development of support specifically for the transfusion laboratories. And looking at the themes, then the group of all the key stakeholders came together. And if you go on to the next slide, and that is when, and this just tells you the hemovigilance. Why was this done? Because again, going back to that initial point about safety is at the heart of everything that we do. And these activities were driven by the concerns that were actually raised by the reports that were submitted to SHOT. So if we go on to the next one. So it was in 2006 that led to the development of the outcome of these meetings led to the development of UKTLC. And I'll hand it over to Kerry to go into more details about how UKTLC came into existence, what are all the key collaborators, and what are the outputs like. So thanks, Karen.
Thank you, Shruti. Good afternoon, everyone. So in short, what is the UKTLC? Well, this would be our definition now. We're a collaboration of UK transfusion laboratory professionals who used evidence-based tools to reduce errors occurring with the labs to try and improve patient safety in our field of blood transfusion. These are our current collaborators across the devolved nations, and this is important. We can ensure that we are working together in line with key regulations and standards and having a unified response in the information that we are putting out to you and the support that we're offering. Next slide, please, Karen.
Sorry, Kerry, I'm just having some difficulty moving the slides forward.
No problem. So I think the next slides go on to talk about, yes, how the UKTLC was formed. So as Shruti alluded to, it was formed in 2006 in a response to the wrong blood events that were reported to SHOT that were originating in the hospital transfusion laboratory. And the focus previously was on how we could resolve clinical errors. So SHOT approached the IBMS and facilitated a meeting between themselves and other key stakeholders working in the laboratory transfusions. And the UKTLC was formed as a result of those meetings. Why is it still important today? So this was back in 2006 when it was formed. Well, however, although transfusion-related risk of death remains low and transfusion overall is a safe process, there is still a large amount of errors reported to SHOT every year, and 81.3% of these would have been preventable. And of that 81.3%, last year, 18% were preventable errors occurring in the laboratory. And from those errors, we can pull out themes that are the root cause of the things that are going wrong. And the common themes are around training and competency, people working alone, IT systems, and communication. Next slide, please, Karen. So the UKTLC produced a series of recommendations in 2009, and those recommendations were an output of workshops and the evidence that was gathered. And the aim of those was to assist in reducing laboratory errors by providing a framework for education and training and the use of information technology. Next slide, please, Karen. And it was expected that the release of the recommendations would lead to around a 50% reduction in the errors that were seen in the SHOT reports. Unfortunately, this didn't happen. And actually, in some areas, there was an increase in errors seen, for example, in the IT chapters. So the UKTLC surveyed the laboratories to ask what they thought of the recommendations and what the blocks may be. And the common theme that came across was that the recommendations were thought to be excellent, but management saw them as not having any teeth. There was no mandatory requirement to take action based on the recommendations. Therefore, the UKTLC went back to the drawing board, and in 2014, they redrafted and published the recommendations as actual evidence-based standards. Linking with the MHRA, they agreed to support the standards as part of their expectorate, and we'll hear more about that later. And later, UCAS also came on board, and this process gave the standards the teeth that they lacked before. Next slide, please, Karen. So where are we now? Well, the world has changed from the 2014 draft of the standards. We've seen lots of changes in clinical and laboratory practice, lots of advances in information technology and automation. There are changes to the education that's available to us. We have more data from the UKTLC surveys and the culture survey that Jenny will be talking to you about later. And we also have Transfusion 2024 and the objectives that we'd like to see for the future to make transfusion safer. Next slide, please, Karen. So the 2014 standards were redrafted with all of this in mind. And what the UKTLC was hoping to achieve were the following things. So we wanted to conform with changes in transfusion laboratory medicine, think about what's going to change in the future to make the standards a bit more robust and future-proof, and think about the need for things such as full vein-to-vein information technology. The standards were drafted to be as pragmatic as possible to enable laboratories to implement them and improve safety. And the UKTLC is reframing it as being an approachable team for support. So one of the things that we have found is that the UKTLC is not well known, and hence we are publicising what we do and how we may be able to help improve transfusion safety. As part of that, on the SHOT website, you'll find examples and support documentation to help laboratories implement the new standards. Next slide, please, Karen. So the 2023 standards are split into four main categories, which are those below: staffing, qualification, knowledge and skills, information technology, and the new one is a just culture. Thank you, Karen. So if we take a look at part of the standards, we start with staffing. Why is staffing important in the 2023 standards? Well, we can see evidence of unsafe practice related to inadequate staffing levels, which lead to incidents reported to SHOT and the MHRA. We know that nationally we have challenges with recruitment and retention. We know that we have a high turnover and some very inexperienced staff, perhaps sometimes working alone out of hours. And all of this also has an impact on staff morale and our ability to retain people in the profession. Next slide, please, Karen. If you could go back one for me. So some of the key things in the standards to help with laboratory staffing are the elements around capacity planning. And on the SHOT website, you will find some examples of how to put together a capacity plan. The standards talk about adequate numbers of staff to provide a safe service and adequate specialist staff to support our inexperienced colleagues and to offer advice. The standards talk about incorporating risk assessment and review and going through governance and highlighting risks to senior managers to prompt staffing reviews and potential investment in the laboratory staffing. Thank you, Karen. I'm not going to cover capacity planning in this session. However, I think this is probably one of the most important things to point out. Once you have your capacity plan in place, you have a lot of data and information to help you escalate the issues to management levels and exec levels. So please, when you're putting your capacity plans together, make sure you incorporate the risk rating and highlight the risk to those above. Thank you, Karen. So if we talk about the qualification knowledge and skills, we know that inadequate knowledge leads to errors and can have a negative impact on our patients. We know that 23% of those shot lab errors involved members of staff lone working. So the standards aim to give guidance for qualifications and require competency assessment and are designed to support all staff working in blood transfusion, including locums, support staff, quality managers. We've split this into the levels. So band 7 and above will include your transfusion laboratory managers and anybody who has who looks after the laboratory management level. There's a list of recommended qualifications. However, we were talking about being pragmatic, and we know that sometimes you may have a member of a team who has been in the role for a very long time and has all the knowledge and skills they need. So there is the availability to risk assess your post and your person against the qualifications that are listed in the appendix. And there's some examples on the UKTLC website of how you might do that, how you might benchmark against the IBMS highest specialist. Thank you, Karen. Going on to think about our advanced scientists, our band 7s and above, the recommendations suggest that people should have 10 working days per year performing practical laboratory tasks. That is for those who are expected to perform routine tasks during the day. It may be that you never work routinely on the bench, and therefore that may not be applicable to you, and that is clearly laid out in the standard. They talk about practical knowledge-based competency and participation in education, not just around scientific education, but also leadership, quality management activities, all the things that are required when you get to this advanced level. The standards talk about having someone available at all times to provide specialist advice. And there are lots of ways you could do this, either via a network or an on-call system. And the standards also try to protect the advanced scientist time in that they should not be routinely rostered for practical service provision and out of hours working. Then we move on to our band 6 scientific staff and the expectation of the education level that they should have to work safely in transfusion, with the same ability to benchmark, but this time against the IBMS specialist portfolio learning outcomes. And again, there's an example of how you might like to do that on the UKTLC website. Anybody who's working at band 5 would be expected to be working towards Appendix B. And the appendices include all staff, so including locum staff, and that everybody should go through the same training and competency program. Thank you, Karen. The standards clarify that anybody who is undergoing training should be supervised by a HCPC registered staff member. You might think that's obvious, but there are incidents occurring where trainee staff are not supported and not supervised and therefore are making errors. The standards also cover support staff and talk about you having a locally defined scope of practice for those staff and access to HCPC registered scientists at all times to support them. It touches on quality managers and that the quality managers should either have the qualifications from Appendix A or seek advice from someone who does when they're supporting the blood transfusion service. And that also quality managers should do CPD on the regulatory aspects of transfusion. Karen. The standards also cover induction training programs, what a competency assessment program might look like and how that should be locally defined, risk assessed and periodic. As I've said, it covers all the staff that will be working in the transfusion service, and it talks about linking to your capacity plan. This will enable you to escalate issues such as a poor trained to trainee ratio. And the standard also covers the need to have a training budget and protected time to enable our teams to fulfill these requirements. Thank you, Karen. So moving on to information technology. Why is it important? Well, information technology has grown and boomed over the last 10 to 15 years, and the 2020 SHOT report had 474 errors related to IT. The SHOT script group have already found an evidence that there are deficiencies in upgrades or the number of upgrades carried out, that there are missed opportunities for IT safety improvements, and that despite the fact that electronic blood management systems are recommended, 43% of hospitals that responded still do not have one of these in place. So the standards talk about some expectations for information technology. One very clear one is that laboratories should have a complete automated walk-away system that is operational 24 hours, 7 days a week. So not in the day we use our automation and at night we do something different. It talks about the LIMS and the requirements in the LIMS for electronic issue, remote issue, how you should have a robust contingency in place, and how we should be merging records. Other considerations in the standards are electronic blood management systems, as we've talked about. There's a little bit about temperature monitoring and interfacing. Thank you, Karen. And the fourth one, which is the new one of a just culture, really is about making sure that we are learning from excellence and that we are encouraging and looking after our teams and that they are able to report incidences and things that they are worried about. So the laboratory management should be supporting a just and learning culture and encouraging staff to come forward with reports of errors or any suggestions for improvement. There should be a process to learn from excellence. Incident investigations must include human factors and systems thinking and not blaming of individuals. If you dig into the incident, and Chris Robbie would talk to you about this another time, you will find that there is often another root cause underlying. Thank you, Karen. So I'm just going to touch briefly on the MHRA because I'm going to hand over to Chris shortly. But the MHRA actually inspect against the good practice guide, but any deficiencies they find following that are not rooted in following best practice may lead them to look at why the UKTLC standards are not being implemented and expectations for the trust to demonstrate why they haven't followed the standards. UKAS are similar. They inspect against ISO 15189, but they expect laboratories to review all national guidelines and justify why they may not have acted upon them. So you could have findings. We are currently working on promoting the 2023 standards. We now have the UKTLC website hosted on the shop page. We have a Twitter account. We're hosting several education events, this being one of them. We'll be available at the IBMS and the BBTS if anybody wants to see us, and we'll also be giving some talks. There was an RCPAF and an IBMS article printed, and we have a submission to transfusion medicine for the 2023 standards. Thank you, Karen. And I'm now going to hand over to Chris Robbie, who is the Haemovigilance team lead for the MHRA. Thank you very much.
Thank you, Kerry. The purpose of the MHRA's position within UKTLC is more of an advisory role rather than an active participant in writing the standards. As with all regulators, we must be careful that any advice given is not too prescriptive. For example, where the legal requirement is for personnel to be available in sufficient numbers to carry out the activities covered and to be trained and assessed as competent, the MHRA cannot dictate how many staff there should be, nor how staff should be trained and assessed. Our purpose, therefore, is to ensure that these standards are written in such a way so as not to contradict the blood safety and quality regulations and the good practice guide, and that they also don't fall short of any legal requirements. So the BSQRs stipulate that the legal and regulatory requirements must be met. The good practice guide advises how you should build your quality system to meet these requirements, and the UKTLC standard should be used to determine exactly what elements need to be incorporated practically. An MHRA inspection will be conducted according to the good practice guide and the blood safety and quality regulations rather than the UKTLC standard. However, when assessing compliance with the BSQR, if the UKTLC standards are not incorporated, the hospital blood bank will be required to provide adequate justification for not doing so, or demonstrate an alternative method for compliance. Thank you. I shall hand back.
Thanks very much, Chris. So over to me now. I'm just going to talk now through the results of the UKTLC survey that was sent out in 2022. So the UKTLC do a survey every 2 years, And this is sent out to hospitals in the UK via the SHOT group. And the intention of the survey is to look at a snapshot of working conditions on a single day in the laboratory. And the results from surveys going back as far as 2015, you can have a look at those. They're all on the UKTLC page of the SHOT website. The website address is shown on this screen here. And in addition to the regular biennial surveys, the UKTLC also have performed a survey of laboratory culture, and those results are also on the website. Thanks, Karen. So before we look at the results from the 2022 survey, I thought it might be just useful to pause and reflect on the key findings from the last survey in 2019. And obviously this survey was done before COVID came along and basically threw us into turmoil. But I've picked this up off the website here. And you can see back in 2019 that labs were struggling with staffing levels and staff were having to work extra hours to meet demand. And we were seeing high numbers of staff in training and lack of specialist staff to support that training. And labs were reporting issues with the level of vacancies and concerns around de-skilling at lower bands. And with the 2022 survey, we wanted to see if there'd been any changes in the key findings since 2019. Thank you. So the 2022 survey was sent to all hospitals that report SHOT. And it was open between the 26th of September to the 9th of December of that year. And we included 45 questions that related to a variety of laboratory activities. So it was quite a long survey, but the questions were really important because they were going to provide really valuable information about what's truly happening in the labs. And we asked for one response per lab, so not a response from a network or a trust or health board that might have multiple labs. And although some of the questions we asked were the same as previous surveys, we did also incorporate some new questions as well. So we had 74 responses back, which was represented a 49% response rate, which was a decrease from the 56% in the 2019 survey. And this was quite a disappointing response rate, but I think it is just reflective really of the challenges that labs have been facing, and also perhaps of the number of surveys that have been sent out, which may have resulted in a bit of survey fatigue for some. We found that the survey was mainly completed by the transfusion lab managers, as we expected it to be, but we did get some responses that had been completed by transfusion practitioners, blood sciences manager, transfusion lead BMS, and deputy director of acute services. And we had responses from labs across all the devolved nations in the UK. And we did ask a question about workload for the labs, and you can see here that we had responses from labs across a wide range of workload, and that's as demonstrated by the number of group and save samples processed per year. Thanks, Karen. So as I mentioned earlier, the survey had 45 questions. So obviously I'm not going to be able to go through every question in this presentation, but what I'm going to do is just focus in on some of the key findings that are linked to the standards that Kerry has just talked to you about. So around staffing, qualifications, knowledge and skills, information technology, and just culture. And then also have a look at the responses around how the UKTLC standards themselves have been helpful to labs, and also what more you said you'd like to see from the UKTLC. So firstly, looking at standard 1, which is staffing. And we asked about how the workload has changed since the previous year. Has it gone up? Has it gone down? Has it remained the same? And this graph shows that the changes in workload reported in, and this is looking at comparison against surveys going back to 2015. And you can see that nearly 61% of labs had seen an increase in workload reporting in 2022, but this was less than a 50% increase. And this seems to be a similar theme across most survey years. Thanks, Karen. And as Kerry mentioned earlier, that capacity planning is really an integral part of providing a safe service and ensuring that the labs have an adequate number of staff to provide that service. And we know that labs have struggled in the past with capacity planning. And we saw in the 2019 survey that only 62% had capacity plans. So it was really good and encouraging to see that in the 2022 survey, over 86% of the labs did have capacity plans in place. However, the labs did report challenges with complying with their capacity plans, both in staff numbers and also in skill mix as well. And obviously we do have this document on the UKTLC webpage that Kerry mentioned earlier that does provide some guidance on creating and monitoring capacity plans. So please do have a look at that if you need help with your capacity plans. Thanks, Karen. So we asked if the labs were carrying vacancies, and this included transfusion labs or haematology and transfusion labs where they were combined. And we also asked that vacancies should be included where they're currently filled by locum or agency staff. And you can see from this graph that the number of labs carrying vacancies has been steadily increasing over the years since 2013, but there has been a significant jump in 2022. And this appeared to be mainly related to vacancies created by retirement and maternity leave. Thanks, Karen. So obviously with high levels of vacancies, there's going to be lots of recruitment going on. And we asked the lab about the satisfaction with the number, the suitability and the calibre of applicants that are being interviewed for HCPC registered biomedical scientist roles. And we asked if these were considered to be poor, adequate, good or very good. And you can see from this graph that there was quite a spread of satisfaction levels relating to the number of applicants, but generally the suitability and the calibre of the applicants was considered poor or only adequate. Thanks, Karen. And we also asked about the use of locum or agency staff in the labs. And firstly, we asked that's super, thank you. Firstly, we asked whether use was allowed, and the majority reported that either long-term or short-term use was permitted. Although nearly 18% said that they weren't allowed to employ locum or agency staff. And we also asked how often locum or agency staff had been employed. And although nearly 37% of labs had never had to employ locum or agency staff, the majority of respondents did state that they had sometimes, often or always had to employ these temporary staff. Thanks, Karen. So where locum or agency staff were employed, we asked about the training they received to work in the lab. And it was really encouraging to note that in the vast majority of labs, the temporary staff received the same training and competency assessment as the permanent staff. But for the small number that answered no to this question, the temporary staff were either always supervised or only allowed to work independently after a period of supervision. Thanks, Karen. So now looking at standard 2, which is the qualification, knowledge and skills. And as this survey was designed to look at the snapshot of the working conditions, we did ask if all the BMS staff working on the previous night to when the survey was filled in had completed and were up to date with the blood transfusion laboratories training and competency assessment programme. And you can see here on this chart that the vast majority were up to date, which was great. And for the small number that were not up to date, this was reported as being due to pressures of work, staffing issues, or the number of competencies required for them to be working across transfusion and haematology. Thanks, Karen. So focusing in a bit on staff working at supervisory level, we asked about how many labs the transfusion managers were responsible for. And there appears to be a bit of an increase over the years in the number of labs that transfusion managers are responsible for. And this probably reflects the creation of pathology networks and hospital mergers. Thanks, Karen. And we also asked whether transfusion managers were having to work routinely on the bench. And you can see on this chart that nearly 61% of them were working between 1 to 3 hours, moving up until more than 12 hours per week on the bench. And although some of them might have to, and this might be positive in terms of maintaining competency, it can also have a negative impact for quality and compliance work as well. Thanks, Karen. So in terms of quality and compliance, we did ask if the managers or other supervisory staff with responsibility for quality and compliance work had protected time to do this. And over 66% that they did have protected time, which was great. But when it came to adhering to this, it didn't always happen. And again, this was mainly related to inadequate staffing levels and them having to cover on the bench. Thanks, Karen. And we asked whether staff working unsupervised had the appropriate qualifications and experience as stipulated in the UKTLC standards. And if they didn't, then why was this not the case? And we had 51 responses where the staff did not comply with the standards. And this was mainly because the staff were either working towards the qualifications or they were multidisciplinary and so didn't have transfusion specific qualifications, or they had the local equivalent training to meet that standard. Thanks, Karen. And we asked also about the education of newly HCPC registered staff and whether you were satisfied with the level of knowledge and understanding of transfusion within this group. And sadly, most respondents felt that the level of knowledge and understanding was poor or only adequate. Thank you. And we also asked a question about whether the ability to train or mentor inexperienced staff had altered in previous surveys, we'd asked about 2 years. In the most recent survey, we asked about 3 years. And we asked if you felt this had remained the same, become easier or more difficult over the years. And we can see that in 2022, quite a jump in the number of respondents saying that this has become more difficult for them. Thank you. And we asked also about the availability of funding to support staff training. And this seems to be really variable across labs, with some saying there's no funding available and others reporting an increase or a decrease. There doesn't seem to be any consistency in funding availability. Thanks. And we asked about access to specialist laboratory advice out of hours, as this was raised as a concern in previous survey. And again, in this survey, we saw that over 40% of respondents stated that there was no formal access to specialist advice, although many do now have this in place. Thanks, Karen. So moving on to standard 3, information technology, we asked a question about the use of electronic blood management systems, EBMS. And as Kerry was saying earlier, that although the use of these systems have been recommended by SHOT since 2017, and there's plenty of publications out there supporting their role in patient safety, there's still a lot of hospitals that do not have them in place. And only 16 of our respondents had a full vein-to-vein system in place, which included cold chain sample collection and administration. Thanks, Karen. And in the 2023 standards, obviously, we've included a recommendation for a just culture within the labs. And we asked the respondents, laboratories if they felt that this was in place. And it was really reassuring to see that nearly all of them felt that they did have this in place in their labs. Thank you. And as part of this, we also asked whether human factors principles were included in transfusion practices. And again, super response that most people do include these. Thank you. But we also asked how and where human factors principles were included in practices. And you can see from this chart that it is mainly within incident investigation, which is really important, and it's great to see that. And some labs are also incorporating it into other aspects, including implementation of new processes, evaluation of your current processes, implementation of new equipment and staff training. And it would be really good to see an increase in those areas as well. Thanks, Karen. And we wanted to know from you how you felt the UKTLC standards had been useful in changing practice for transfusion labs over the years. And there's a lot of information on this chart. I'm not going to read them all out, but it's really nice to see that the standards have been having and are having an impact over a wide range of aspects. Thank you. And also going on from this, we asked you if there were any other areas you'd like to see covered by the standards that hadn't been covered previously. And respondents did note that they would like to see requirements for transfusion lab managers, and that was particularly related to knowledge, qualifications and skills. And as Kerry mentioned earlier, this is now covered in the new standards. Thanks, Karen. So we've gone through quite a lot of information over the last few slides, but just to distill it down now into the really key findings. So staffing, it still seems to be a real challenge, including recruitment and retention, the qualification and education of training. Or have we jumped on a slide? Are you able to go back a slide? Sorry, Karen, thank you. And also staffing issues around the high level of vacancies, the staffing numbers and the skill mix. And EBMS, incorporating that into and implementing that is still not available in all organisations. And there appears to be issues with funding, building business cases and getting engagement and support for putting these systems into hospitals. And also on the just culture and how to embed this into all aspects of practice, including learning from excellence. Thank you. So in this final slide, I thought it might be useful to signpost some practical help for dealing with some of these challenges that have been highlighted in the survey. And this isn't all of the help that's out there, but just a few signposts here. So in terms of staffing, we'd really like to encourage the educational providers to link with local hospital employers to ensure that transfusion's adequately covered. And we're now starting to see practice educator or training lead roles coming in to cover hospitals, supporting the training of staff, which is really great. And as I said earlier, to support with capacity planning, we have the guidance and other documents that you can access on our UKTLC page on the SHOT website. For EBMS, all the governments in the devolved nations now have digital strategies. And in England, we also have the Transfusion 2024 that's doing some really great work in supporting EBMS and other IT systems as well. And the SHOT script group have provided guidance and toolkits to help with implementing electronic systems. And to help embed that just culture in our laboratories, SHOT have a plethora of really useful documents that promote learning from excellence and human factors. And also the Civility Saves Lives website, I think, has got some really great resources that you can tap into as well. So we'll be using the results of this survey, including the responses to other questions that I haven't been able to go over in this presentation, to work with other organisations and bodies to further support hospital transfusion labs. And the UKTLC is here to support you, so please do look at our webpage and please do contact us. Thank you very much for listening.
Thank you for that, Jenny. And before we move on to the Q&A session, please can I draw your attention to the number of free accessible resources which are available on the SHOT website. So please do have a look when you get the time. Next slide, please, Shruti. The SHOT app is also available, and this can be downloaded off the website too. You can stay informed and have access to our annual SHOT report and the current resources by downloading this app, which can be used in any clinical area or laboratory. The annual SHOT Symposium is happening on the 4th of July at the Etihad Stadium in Manchester. This will be a face-to-face event this year, and we would love to see you there. Please visit the website for further details on how to register. I would like to take this opportunity to thank my team and the members of the wider team, like the Working Expert Group and the SHOT Steering Group, as well as our esteemed colleagues at the MHRA, the UK Forum, and our stakeholders. And lastly, thank you to all of the reporters for continuing to submit and complete reports in these very challenging times. For all this and more, we continue to appreciate your efforts and remain grateful for your input.